Hello everyone. Welcome to our YouTube channel. Today we are gonna talk about insulin.
You can't take insulin by mouth. You must inject it with a syringe, insulin pen, or insulin pump. The type of insulin injection you use will be based on your personal preference, health needs, and insurance coverage. Your doctor or diabetes educator will show you how to give yourself the injections. You can inject the insulin under the skin in many different parts of your body, such as thighs, buttocks, upper arms and abdomen. Don't inject insulin within 2 inches of your belly button because your body won't absorb it as well. You should vary the location of injections to prevent the thickening of your skin from constant insulin exposure. Insulin use varies by person according to their blood glucose levels and diabetes management goals. Your doctor may instruct you to give yourself insulin 60 minutes before a meal or just before eating. The amount of insulin you'll need on a daily basis depends on factors such as your diet, level of physical activity, and severity of your diabetes. Some people only need 1 insulin shot per day. Others need 3 or 4. Your doctor may also have you use both rapid-acting insulin and long-acting insulin. Insulin helps keep your blood glucose level within a healthy range. Healthy blood glucose levels help reduce the risk of diabetes complications, such as blindness and the loss of limbs. It's important to monitor your blood glucose level regularly if you have diabetes. You should also make lifestyle changes to prevent your blood glucose level from getting too high. And talk to your doctor about ways to make your treatment with insulin as effective as possible.
Thank you for watching, and we will come back soon with our next video. Until then, subscribe the channel and hit the bell button.